And time now for our community update this morning. And joining us for the first time is the Oneida Nation Tribal Chairman, Tahassi Hill. Thanks for joining us this morning.
Oh, you're welcome. Glad I could be here.
Now, how has the pandemic affected your community?
Well, we've seen this, we were notified of this early on, January, and we have taken action by, I think it was January 22nd, to make sure that we were taking action for social distancing. We had an upcoming General Tribal Council meeting in March, mid-March, that about 1,800 people generally attend, and so we had taken action to cancel that meeting to make sure that we weren't providing an opportunity, I guess, for the virus to spread very quickly through our community.
And you have made the order, you've extended it a couple of times, haven't you?
Yes, we extended our Safer at Home order, our public health emergency order several times now, and so we do that in about a 30-day increment. So right now, our current order will go until September 11th.
Now, what has the tribe's response to the COVID-19 pandemic encompass all?
Well, we've taken a lot of early actions. Obviously, the shutting down of the schools and was probably one of the first moves that were taken, and also shutting down of visitors to our nursing home. Obviously, the area with a lot of elderly people in that category that would be detrimentally or deadly to their health, and so we're still practicing that safety measure as well currently, of making sure that there are no visitors to our nursing home. Our health center, which sees thousands of patients a year, a lot of the wellness checkups and things like that, and dental, regular routine health care have been canceled or postponed until we can get a better handle on this. That's just to make sure that people who are healthy aren't intermingling in the facility with people that are sick and being a potential another place where the disease can spread. We've also taken action to modify our elderly meal site. We provide lunch 5 days a week to the elders in our community, and there was a facility that they would come and congregate at, and so we've taken measures to stop that as well, and to put in place eventually a food delivery system, providing meals throughout the week being delivered to their homes, very similar to Meals on Wheels. And so there's a lot of actions been taken, and ultimately mid-March also, when we declared our first public health emergency, we also shut down our gaming facility shortly after that, as we had seen that there was going to be customers coming from further away, more hotspot areas like Milwaukee. When Potawatomi chose to shut down their gaming facility, we immediately started getting calls asking if we were open, and so we seen that as a red flag immediately and decided to shut down our gaming facilities much earlier than we had planned.
Okay, how has COVID-19 impacted employment?
Well, I think that is a very one of our most difficult things we had to deal with, obviously, with shutting down our casinos for, I believe it was 68 days, which is our main revenue driver. And the revenue from those gaming facilities fund much of the programs and services that we provide to our community and to our membership, but also provides that revenue for those jobs. And so not having the revenue for those jobs, we were ultimately had to lay off a little over 1,900 employees during this time, which obviously has very negatively affected them, their families, and us as well. We really look at our employees as members of our family, members of our community, so making sure that they have gainful employment and providing that in our community was one of the things that we really pride ourselves on. So having to make that determination to lay people off was very hard.
Okay, thank you very much for joining us today, Chairman Hill. We appreciate your time.
You're welcome.